Hi there, how's it going? Welcome to another podcast. This time my guest is Andrew Feldmar, who is really an expert in psychotherapy. He's also used substances like LSD and MDMA in psychotherapy, and that's a lot of what we're talking about here. He gives a lot of credit to his mentor, who is R.D. Laing, a pretty famous Scottish psychotherapist who worked with LSD a lot in the 60s. And Andrew worked with him and learned a lot from his time with R.D. Laing, and so references him a lot. And that's who that is, who we're talking about on this podcast. And, since then, LSD is obviously illegal, and Andrew has continued to practice with and without these substances, doing psychotherapy. And he's continued to learn and really evolve his practice. And he's got a lot to share as far as how we practice this psychotherapy today, and how we're not necessarily helping people in the best way and not necessarily training our new therapists in the best way. And that's what we start out this podcast talking about, is how we're educating people and training these new psychotherapists. And also, Andrew in recent years has worked with the organization MAPS, which is the Multi-Disciplinary Association for Psychedelic Studies. And in Vancouver, they did a study where they used psychedelic-assisted psychotherapy with the substance MDMA and helped people who were suffering from post-traumatic stress, had severe anxiety and different disorders from trauma. And Andrew was one of the psychotherapists who worked in this study. So we talk about that as well. And, we get into a lot. Like I said, Andrew really knows what he's talking about. He has a lot to share here. And I think if you're someone like me who's interested in psychedelics, in psychotherapy, potentially in the future, this is a great one to listen to, because Andrew has a lot to offer. So, he's also a really funny guy with great stories. So, check it out, enjoy it. This is me with Andrew Feldmar.
What I would say is that most medical schools who train psychiatrists, most graduate schools who train psychologists and psychotherapists, basically teach people, they're acting schools. For example, no psychiatrist or psychologist is supposed to, they never even contemplated the question, what do you do when you don't know what to do? That's just not allowed. Right. The whole training, the whole medical psychiatric training and psychology training is about pretending certainty. Now, to me, that's really ridiculous, because there are case histories of famous madmen, and if you study them, like Judge Schreber, a famous German case, even Freud wrote about him. He wrote a diary during his madness, and he came back from madness. And in all these accounts, you can see that madness is always, it occurs when the person is certain. So the sign of madness is certainty. I'm Jesus Christ. And I have no doubt Schreber was, he had experiences where God was torturing him with all sorts of electricity and so on up his anus. And he was absolutely certain that it was God who was torturing him. Wow. And the moment where he was returning to sanity occurred when he started to have doubt. So I would say doubt is a sign of sanity, and certainty is a sign of insanity. And yet, psychiatrists, even today in graduate schools and psychologists, are trained to pretend certainty. And Wittgenstein, one of the top philosophers of the last couple of centuries, said certainty is a tone of voice. And that's all it is. I mean, you can have certainty in some of the sciences, but even there, a really good scientist will say, it works, but we don't know. That everything is a hypothesis. Everything is open to question.
Right.
Not in psychiatry. It's full of dogma.
Yeah.
The original therapists in ancient Greece were the skeptics. Right. And they thought that philosophy, if it didn't have curative properties, then it's not worth the name. So philosophy was always trying to help people who suffer. And they thought that people suffer because of their dogmas. And so the skeptics went around, they were the healers, they were the psychotherapists. They went around basically asking people who thought they knew, are you sure?
Right. And that's the idea with Socrates, right?
Yeah, that was the major question. And so, Laing questioned the whole business of labeling people, of the whole question of, is there such a thing as mental illness? With Thomas Sass, he thought it was a very bad metaphor. Either there are diseases of the brain, in which case go to a neurologist, or there are problems in living, in which case you don't have to be a doctor and it doesn't belong to medicine. Freud himself waged a battle for lay analysts, so-called lay analysts who weren't physicians. He said, what does medicine have to do with it? Nothing. Right. It's an accident that all this stuff fell under the power of medicine. It's the wrong metaphor. Already Aristotle said that there are three sciences. There are the theoretical sciences like mathematics and physics. There are the productive sciences, and he gave examples like architecture, knife manufacturing, or medicine, where there is a blueprint. There's a blueprint, and I build a building, you compare it to the blueprint, it's a good building if it fits.
Right. Yeah.
You know what a good knife is, produce one, and then it's a good knife. And medicine, really, if I break my arm, I'd like to go to a productive scientist who can produce repair my bones as they should be according to blueprint.
Right.
And then he said there are the third kind of sciences, and he named two, ethics and politics, where there is no theory and there is no blueprint, where you have to do it by the seat of your pants because it's situational.
Right.
Because never anything repeats. Every moment is unique in itself, and you have to do it by the seat of your pants. Ethics and politics. I say psychotherapy is a practical science. That's what he called the third group. And basically, all my work, almost all of it, is about ethics, which is how we treat each other, and politics, which is the art of accruing enough personal power that you can do what you want and not what you don't want.
Yeah.
People suffer because of lack of power and because they are treated badly or because they treat people badly.
Right.
So all of my practice is really practical science, nothing about medicine, nothing about theoretical psychology. Any psychology I ever learned, it was only good to get my license to practice.
Yeah, right.
Doing it is totally irrelevant.
So you're talking about sort of the difference between giving someone a diagnosis and a prescription, and then maybe talking about how they live their life.
Well, yeah, and of course the big difference is if you come to me and you're suffering, and I give you a diagnosis, and let's pretend that you are ill. So I tell you what your illness is and give you a regimen of some sort. Then the assumption, the unexamined assumption, is that there is something wrong with you. Because if there wasn't anything wrong with you, you wouldn't be suffering. And that just isn't true. The trouble is always between us, not in you and in me. People suffer like the childhood disasters, traumas, always happen between people, not within.
Right.
You know,
that's something you talk about a lot, this idea of a relationship, that everything seems to be a relationship between two things.
Yeah, and I am through you, so I. So I would say after about age 16, you're responsible for the company you keep. But
Right.
most people don't know that. You know, you're not responsible for the family you're born into.
Mm-hmm.
That's given.
Yeah.
But by the time you're about 16, you have to have the wherewithal to, if it's not a pleasant company, if your family members are not the people in the world that you'd rather be with than anyone else,
Right.
well, then what the hell? Leave them and create a family for yourself of people that it's fun to be with.
Right. So you can put some emphasis on the environment people are in, but also balance it with a personal responsibility to change that environment as well.
Absolutely. And that's the essence of Buddhist psychology. Buddhist psychology says uh, accept yourself, get to know yourself, love yourself. To try to change yourself is an act of violence. Take delight in yourself as you are, and put all your work into creating an environment that compensates you for who you are.
Oh, that's
Work
funny.
on the environment, not on yourself.
Right.
Makes so much more sense.
Yeah. No, I like that idea a lot. I've had that thought when it comes to addiction, that addiction could be a completely natural response for a person within a certain environment.
It is.
Yeah. You agree with that? Yeah.
Absolutely. Like schizophrenia, so-called, is a natural response to a certain environment. They're crazy-making environments. When Laing and Gregory Bateson talked about schizophrenigenic mothers, people were up in arms. You know, like, how dare you?
Right.
Like, to have the medical approach is kind of protecting parents.
It takes the blame off.
Take the blame off. But it's not blame that I would want. I would want responsibility.
Right.
Laing and Sartre talked about demystification as one of the jobs of the therapist. Demystification means usually people say this happened and that happened and this happened and then that happened. And if you really think about it, nothing ever happens. It's always somebody does something to somebody. Who did what to whom? That's the demystification. You're not supposed to know. What did your mother do to you? What did your father do to your mother? What did you do to your sister? That's what gets covered over of, look what happened.
Right, I see what you mean, yeah.
So who did what to whom? Sartre and Laing called praxis. And this happens and that happens and the other thing happens. They called it process. So one of the jobs, one of the few things a therapist can do, one of the few things we can do for each other. Now, you don't even have to be a therapist. We just do it for each other, human beings. Is this demystification, is between us, we can figure out of, you know, let's just really figure out who did what to whom.
But
I'll give you an example.
Okay.
Okay, Gregory Bateson was in a mental hospital visiting a young man, and the young man was totally relaxed. They were having a totally fine conversation. The young man's mother comes in, stops at the door. The young man is here. Mother stops at the door. The mother stops. The young man takes a step towards mother, like to greet her. But as he takes a step towards her, the mother steps back. So the guy stops. And then the mother says, you won't even come and give a hug to your mother. And the guy goes berserk. So that 3 orderlies have to come in and put the guy in a restraining jacket. A straight jacket.
Right, I see what you're getting at now, yeah.
Eject him, like he's the crazy one, right? But Gregory Bateson happened to be there, and he observed who did what to whom. He observed that the mother gave double message to the son. And that's what drives people crazy. that with her body, she said, I don't want you to come close.
Mm-hmm.
And then when he observes that, with words, she says, why aren't you coming to greet me?
Yeah,
Right?
you could see how that could drive someone mad.
That's it. Now, if you're not interested in these details, it's so much simpler and less making the mother responsible to say, put the son out of his misery.
Right. So yeah, saying what happened would be, oh, the guy freaked out. The guy
Yeah,
had a problem.
yeah, which is mystification.
But
The
who
guy,
did what to who is
nobody
she was
out for
hypocritical.
nothing.
Yeah.
Yeah.
So then you'd go to the mother too, and you could say, well, why, you know, because you could blame, you could say, okay, well, the mother is acting strangely, but then you could go further and talk to the mother and say, why is this occurring?
Sure.
And,
Look, most difficulties are multi-generational.
yeah.
But if you are my patient, okay, then I'm not interested in why your mother treated you badly. I don't care.
Right.
First, you have to realize, my God, what she did to me.
Right.
You have to realize it, because if you protect her, you think you're crazy.
Right.
To realize that she's crazy and you're okay allows you to free yourself up. Now, if the mother comes to me for therapy, then we can go into what her mother did to her and so on and so forth.
Right.
But your remark, interestingly, would say you're so protective of your parents that very quickly, before you grieve what they did to you, and that's why I'm saying it's not blaming. I would never blame the mother, but she was responsible for her actions.
Right.
There's no blame, but responsibility. He wasn't responsible. She was.
Right. He was.
She was the chicken. He was the egg.
Yeah, you can kind of go down the line forever otherwise, and
That's
everyone has there's a reason for everyone's behavior down the line, right?
You know, if I could have my hands on Hitler, I would not be interested in how his mother or father treated him badly. I don't care.
Right. Yeah, I see what you mean. And so we can talk about, like, as we get into talking about going further and further, you know, one thing I've seen you discuss a lot in getting to root causes of problems is shame and this feeling of embarrassment, the feeling of being ashamed, and how that leads to things like anger and other emotions, and then down the line leading to extreme actions or things as well.
Well, I actually would say that if I were king, I would legislate that before people would be given permission to have a child, they would have to go to school. And the major subject for future parents would be how to raise children without shaming them, ever. And I would not allow any teacher into a classroom unless the teacher went through a training of how to teach without ever shaming a child.
It sounds very difficult.
Well, it isn't actually. It just requires a bit of understanding. Originally, shame was with biologically, when one organism wants to signal to another organism to back off, you need a signal, a nonverbal signal that's universally recognized. And I think several thousand years ago, when someone blushed, it was like a red traffic light. It meant stop.
Right. Something that a young person could do, even if before language, before they could speak, they can still give that.
Absolutely. Blushing meant you're asking me to do something I'm incapable of doing. Like I'm too young for the demands that you're putting on me. Okay? So it's just like, say, a mother wanting her kid to not wet the bed. Well, the kid doesn't know where the muscle is.
Right.
So the kid feels ashamed that he can't do what the mother is asking,
Right.
because the kid doesn't question the authority of the mother. The kid can't say to the mother, "Back off, mother." Like, I'm only a year old. Like,
Right.
so what if I piss myself until I'm 3? Believe me, by the time I'm 20, I will toilet myself. You don't have to toilet train me. So in our culture, losing control, you get shamed for, like drooling. You're
Right.
not supposed to drool.
Yeah.
Why not? Like, you're sucking on your mother's nipple, and you drool, and some milk comes out. You know, the coupling is not perfect, and the mother starts cleaning and interrupts the feeding. Like, the kid thinks he did something wrong.
Huh.
The kid didn't do anything wrong. It's just the expectations. For example, if a couple comes to me to say that their kid is 8 years old and still wets the bed, I don't want to see the kid. I say to the couple, that's his way of telling you that you're treating him much older than you should. He is begging you to treat him younger, like indulge him, spoil him, pick him up in your arms, treat him as if he were 3 years old.
Is that what you? So you would say an older child peeing the bed? That's in your opinion what that is symbolizing?
Exactly. And those parents who take me seriously and go home and spoil the kid and not shame the kid, their kid stops being in bed within a week, when the kid believes that this is real. Especially smart children, the parents get fooled and forget that emotionally the child is very young, because intellectually the child can be brilliant.
Right.
And then the parents expect all sorts of things from the child that the child can't do. You know, if you said to me, flap your ears without them. Like, there are some people who can move their ears. Can you?
Yeah. No.
No. Okay. So if I thought that you are saying it to me in such a way that I should be able to, and I do, I really want to do it for you, and I can't, I would feel ashamed.
Right. Because it's this idea, I've heard you talk about this idea as well, that when we're young especially, we put on the parents this burden of like knowing everything. Like we naturally think that they have all the answers. So if they're asking us to do something, we should be able to do it because they know we can, or, you know.
That's how it is.
Yeah.
So the other horrible thing about shame is this, that my mother, when I spilled a glass of water, used to say something like, you know, I would say 3 years old, 4 years old, and spill a glass of water. She says, "You clumsy oaf, what's the matter with you? You did it again." Now, that's shaming, okay? Because, first of all, she labels me. She talks about my being. She doesn't talk about what I did.
Right.
She talks about me. That's the difference between shame and guilt. I'll give you an example of guilt in a minute. So she's God, and she calls me a clumsy oaf. That's like hypnosis. I will be a clumsy oaf. I am a clumsy oaf. How can I? My mother says I'm a clumsy oaf. I'm a clumsy oaf.
Right. You believe it.
Yeah. And then she says, "What's the matter with you?" Again, attacking my being. I'm the wrong kind of. I'm fucked.
Yeah.
Like, that's it. There is no hope here. Like, I'm the wrong kind of person. She's disappointed in me. What's the matter with me? Somebody will have to fix me. This is beyond repair on my part. That's the kind of person I am.
Right.
And then she says, "You did it again," which is again implying that I have control. I shouldn't have done it. I should be finished doing that. And here I am doing it again. Totally, I want the earth to open up, swallow me. I don't want to be seen ever again.
Right.
I want to die. People want to die of shame. Okay? Now, when my son was about that old, and he spilled a glass of water. I had the impulse. It almost came out. My mother spoke through me. I almost said to him, "You clumsy oaf." But I could catch myself, and I said kind of in my head, "Hi, Mom."
Yeah, right.
"I'm not gonna let you touch my son." And what I said to my son was, "Wow, look at the mess you made." And I threw him a rag and I said, "Clean it up." So I never said one word about him.
Right.
I just said the obvious. He could agree with me. "Yeah, what a mess." And I did it.
Mm-hmm.
And I gave him immediate possibility for reparation.
Right.
Out of shame, there is no reparation.
Right. You weren't ignoring it. You acknowledged that it happened, but in a better way.
Yeah, but it's irreparable shaming. Whereas pointing out that, it would be better if you didn't do it, and you may want to learn not to do it.
Yeah.
Okay. But it's not calling his being into question.
Right.
So I say that's why if I were king, I would want to teach people, especially teachers and parents, that children have a natural desire for perfection. You never have to criticize children. If you just point out what they do perfectly, they'll be delighted. They need appreciation and encouragement about their developmental milestones, not hurried up to do more things than they can already do. In schools, the teacher could be always interested in what the student knows, not what the student doesn't know.
Right. More encouraging to push.
Absolutely. That's all. There is a method of teaching music called the Suzuki method, which there was this one genius music teacher who said most kids who are forced to learn instruments, piano, violin, whatever, at the moment they grow up, they don't want to play it anymore. Why? Because learning to play the instrument caused millions of moments of shaming. Their teacher shames them, their parents shame them. Why would they want to continue? Shame is a pain to the soul. You put your hand in fire, you never want to do it again.
Right.
So shame discourages people from doing that for which they might be shamed.
Right.
So they never want to do it. So Suzuki said, let's teach children a musical instrument without ever shaming them. So what he taught his teachers, and now there are so many Japanese musicians who are famous. They were all started with the Suzuki method. These were all kids who didn't drop it because they were never shamed. Right. So what he says is, say a kid comes to a lesson and has to play a scale, and he plays every note wrong. But he sits squarely and his arms are horizontal. The teacher says, wonderful posture, perfect posture. Right. The teacher has to be careful not to say something is good that isn't. The teacher can't lie. The teacher has to find something that's genuinely praiseworthy. But he doesn't have to mention that the notes were bad. The kid knows.
Right. Yeah. Right. It's the idea that we already have this desire in us to do a good job, and we can recognize when we are and when we are not.
Absolutely. And with a bit of encouragement and some enthusiasm when you get it, right, the kid is unstoppable.
I think it's reminding me of a story that I think must be from one of the talks I've seen from you, where was it you who talked about a family of carvers who the son was carving, and he was going to carve in a way that cut his finger, but the father, master carver, didn't tell him. I can let you tell the story, but it was interesting.
Well, it was precisely about how not to shame a developing soul. The kid was holding a totem pole with his left hand, and with a very sharp adze was cutting towards his hand.
Right.
And I called the father aside and said, aren't you afraid that he's going to cut his hand? And he says to me, yes, I am. However, I've seen four-fingered carvers.
Right.
I have never seen a carver whose father told him how to do it.
Right.
Right? So he said, I'm hoping that he'll just have a nick, which we can put something on and it will be okay. And he'll learn from his experience.
Right.
Or if it's deeper, the hospital wasn't very far from the anthropology museum where they were doing this. He says, I'll just take him in there and they'll sew his finger back on. Like, you see, that's great wisdom.
And very hard for parents to do, I'm sure.
Yeah, yeah.
Because you want to protect the child, right, from harm and all this.
But it's like underestimating. You know, if I worry about my child gets the message that I don't trust the life that lives him.
Right.
And then he won't trust the life that lives him.
Yeah. I can relate to that because I always feel that I absolutely hate being told what to do. I love to learn on my own and do things on my own.
It's an insult. It's an insult.
Yeah.
There is a French educator who says that teachers stupefy their students. I mean, just get this. It's so simple. Why doesn't anybody think about it? So I'm the teacher. You're my student, okay? Right. So I give you this book and I say, this is the book you have to learn. And then I say, I'll teach it to you. Duh. But that already implies you, man, are too stupid to learn from the book on your own. You need me to understand what's in the book.
Right.
That's dumbing down the students. It creates a job for me. Now, there were some very revolutionary teachers who basically said, I don't want to teach anything. Here is the book. You come and tell me what you find interesting in it. And all the teacher did, shown genuine delight as the students came with what they discovered. No student needs teaching. Right. It dumbs you down.
Right. This idea that we already have the capability in us to learn what we need to learn, what we want to learn.
Of course. The best teacher, like how I teach, because I do teach sometimes, I basically try to model my learning. Like, I think a good teacher would be somebody who's a good learner and who can conduct his education in public.
Right.
So that I can infect people with my curiosity. I can infect people with my enjoyment of finding things out.
Right. That is honestly what I try to do with this podcast too, because what I'm curious about and I'm trying to learn about is the use, and we'll get into it, I'm sure, the use of psychedelics in sort of counseling, therapy type setting. So I interview all these people who have experience in this, and I'm genuinely curious and trying to learn myself because I feel like perhaps one day I will do work like this. But it's this idea that people can learn along with me about how this stuff works and this kind of thing.
Absolutely.
And absolutely. I mean, to transition into that, like I've been talking about like your idea too, talking about how teachers should work. It's very similar to how you describe psychotherapy working, where you're not trying to be this super expert psychotherapist to tell the patient exactly what they need to heal themselves. You're trying to keep it on a more even playing field and talking about it being more of a back and forth relationship with people.
Well, look, a concept in therapy that's been around since 1900 or a bit earlier is transference. Now, the essence of transference, I think, is presuming that the other knows.
Yeah.
I don't know, but you know. That's transference, because I'm transferring my childhood experience when I was little, looked up at my parents, and the child's experience is my parents know everything and I know nothing. So transference is, here I am, 50 years old or 60 years old or 30 years old, and I still look for people who I can pretend know more than I do. So the end of transference, Freud said, is when the patient realizes that he also knows. But Lacan, the French Freud, said even Freud didn't dare to think this one's through, because it's astonishing that the end of transference is when you realize that nobody knows.
Right.
And that's very frightening, because then you ran out of parents, and then we are all brothers and sisters, and there is equality.
Right.
And there isn't that slope of authority. And, you know, look at what's going on in politics. Most people transfer their stupid father onto Trump or somebody like that.
Right.
I mean, how else can you explain what's going on?
I couldn't even begin to try to explain what's going on down there.
No. So I think it's extremely important, like in psychedelic work, now that there is a rebirth, a renewal of interest, scientific and therapeutic interest in psychedelics, or entheogens,
right,
or even empathogens, all this stuff,
these
both
substances
and designer drugs. I think that there is it's seductive to basically recreate a system that hasn't worked, which is, I'm the expert. I'll tell you how to do psychedelics.
Right.
Like nonsense, absolute nonsense. Like there are people who create protocols of how to do it. Absolute nonsense. People now have, they tell you what kind of music to pump into the ears of people who have taken LSD, because it gives you the feeling, I'm the expert. I know what kind of music.
Right.
I proposed at a meeting that, how I might want to do it is, say you want to do a psychedelic session with me, I would say, bring music that you might want to hear, that is meaningful to you. And if the spirit moves us, I'll put it on for you if you ask for it. Bring your own emotionally filled, important music.
Right.
Now, the learned circle of experts answered that the people who come to them for psychedelic therapy need a musical education. The music they would bring is uneducated and simple and the wrong kind of music.
That's assuming a lot, isn't it?
It's assuming a lot. Also, I wouldn't even bring up the idea of music unless the person brings it up. Like, who am I? Basically, the insult of psychiatry, the insult of psychology, is that people presume to know better what's good for you than you know yourself. Now, of course, if there is something wrong with my kidney, I hope that you would know about kidneys more than I do.
Right, right.
But there is no blueprint for a good Andrew. So
right.
I'm going to, I have an agreement with my wife that no matter how crazy I act, she's not to allow a psychiatrist near me ever. Like, how would he know what I need better than I do myself?
Right. But does that kind of thinking put you at odds then? Because I can describe a little bit the study that you've been a part of for, I think, years now. You've been working with MAPS, though, right? MAPS Canada, right, with Ingrid Pacey, and you've been using MDMA to do assisted psychotherapy with people who have trauma,
severe PTSD.
Right. And so, from what I know about MAPS, they do have a pretty structured way of doing these studies. So, have you found that difficult?
Yes,
you have.
Impossible. I think it's good for the purpose that they use it for, because their major aim is to legalize these drugs. All the experiments that they are doing, it's really for the federal FDA, the Drug Administration, or Health Canada. We did, so that they would remove these drugs from the restricted list and make it a prescription drug, not to the patient, but to qualified therapists. So I think the political aim, I'm 100% behind MAPS, but I think that they forget that if we are talking about the good of the patient, to
Right.
make sure that we do no harm, you can't do it that way. So it's a little bit weird that the research cannot be what is really needed for the patient.
Right.
So even with this tilted and controlled way, it shows now all over the world there have been studies that confirm and affirm each other that MDMA as an adjunct of therapy, it makes the therapy more effective and relieves PTSD symptoms tremendously.
Right. It still is working, even in this
Even
overly
if
structured way.
that's so, imagine how well it works
Right.
when someone puts his or her heart into it, and the therapy is conducted how it ought to be.
So yeah, I was gonna ask you about that. It's funny, I didn't expect. Well, I wasn't sure how you would find this research you've been doing, but I mean, obviously, it's still successful. It's just
Yeah,
they're trying to, like you said, they're trying to. It's like a means to an end. They're trying to push this stuff into some sort of legalized capacity, and to do that,
yeah,
they have to fit it into the medical model of
yeah.
doing these controlled studies.
Exactly. So I'm not a part of it anymore. I finished with it. Ingrid has finished with it.
Oh, okay.
Phase 3 is going to be organized. It's other people who are going to do it. But I'm 100% supportive because I do think these drugs should be legalized. I'm now trying to convince people that in the training of future psychedelic therapists, what won't be research anymore, you have to train them differently than you train the researchers.
Right. It's a different thing.
That's right.
So yeah, and you talk about apprenticeship over some sort of more formalized classroom type of training.
Absolutely. The skills that a therapist needs, the best. Here is an interesting thing about psychology. I took, I don't know, 4-6 years of psychology. Not once was, and we had learning theory, theories of learning, this and that and the other thing. Well, we learn paired associate learning, which is, how long does one remember if two nonsense words are associated? How long do we keep in mind? Can we remember, learn the association between two nonsense syllables? Rote learning, this kind of learning. That nobody ever even once mentioned imitation. And from what I discovered is imitation is the best way, is the most effective way of learning.
Oh, I see what you mean. Yeah.
Like my son was just crawling. He was particularly interested in wall sockets. And he crawled towards the wall socket,
Yeah.
tried to put his finger in there. So I would just gently turn him around and say, no, no, no. No, we don't do that.
Right.
And I did that maybe a dozen times. And the next day, I'm standing in the doorway. He's heading towards, trucking towards the socket. But he stops, shakes his head, and he says to himself, no, no, no. And comes around. He internalized me.
Wow, right.
I can't. It's that kind of involvement between someone who's been practicing, who has been doing it well and effectively. Like, there are a million things that one can pick up through imitation. Like my study with Laing, of course I read everything that he wrote. Of course I read a million things as adjuncts to what he read and what people who he read. Right. Of course I did that. But the style, the actual, and even feeling that, knowing that it works, I can only know it works not hypothetically, but seeing him do it.
You're right.
And being beside him and picking up the vibes. Words are just a very shallow map of reality.
Right.
The territory is always much more complex than the map. So reading and studying, you just get the map. But when you are apprenticing with the master, then you get the territory.
Right. You learn the skill and
That's
the
right.
yeah.
And you learn it non-verbally. You don't even know how you learn it. You just
Right.
absorb it.
Right. And I know you've talked about that too. That was one thing I wanted to ask you about, was this idea, how did you put it, that language even caused suffering, and just that language was this filter that we can only learn so much through and only transfer so much through. But before I get into, I want to talk about, because we've touched on it now, psychedelics in psychotherapy, and your work with R.D. Laing. I believe he used LSD a lot with people. And so you had a lot of experience with that, and now with MDMA. Maybe we can just touch on, in general, you know, if, because you're obviously doing psychotherapy without psychedelics as well. What makes these
Well,
substances useful?
Actually, for that's all I'm doing, except when I have license to do something else.
Right. These days, yeah.
So what's your question?
Is, you know, if you can do psychotherapy without something like LSD or MDMA, why are they helpful in psychotherapy? What do they bring to the table that you can't get without them?
Okay. So let's say, I would say that all psychological problems are due to trauma, without exception. Like all the categories in the diagnostic statistical manual, this thick book of,
yeah.
the witch's hammer that they used to in the Middle Ages carry around and identified witches from. That's what the DSM is today. It's still like we're still in the dark ages in psychiatry. But at any rate, all of it are varieties, flowers of trauma. Like nobody suffers now who wasn't hurt sometime in their lives.
Right.
It doesn't just pop up.
Right.
It doesn't
There's a
happen.
cause and effect at all times.
So, in Judith Lewis Herman is a Harvard-trained psychiatrist who wrote, I think, the best book on trauma and recovery. It's called that, where she lays out what the map is of recovering from trauma. She says there are 3 phases. The first one is developing some measure of safety, security, and trust.
Right.
That's between therapist and patient. That's in the life of the patient. Now, fortunately, she mentions that may take an hour or it may take 10 years. It takes as long as it takes, because if you fake it, if the patient is pushed into saying, oh, I trust you, but it isn't true, everything is waste of time. So it has to be true, genuine trust, safety, and security. Okay? So it takes as long as it takes. Once it's there, automatically, without any tricks, comes remembering and grieving. Once you feel safe, you start remembering who did what to you. And you realize that you've been robbed, that you've been innocent, and you lost out on a lot of things. And the organismic response to realizing irretrievable, irreconcilable loss is grief. So the next stage is grief. And grief is not self-pity. Grief is something that you feel in the middle of your heart, and you feel like your heart will break. And you sob in such a way that you think you'll never stop. So you don't go there easy, and you need company to hold your hand or hold you while you're going through it. Once that's done, because even though it feels like it will never end, it does. By the way, so-called depression is often interrupted or incomplete grieving. The third stage is reconnecting with other human beings in a way you haven't been able to connect with. All connections of traumatized people is distant and iffy because you don't trust anybody. So your connections are all fake and false.
Right.
after this process, you can finally actually connect with people. Big difference. And that's the recovery from trauma. Now, MDMA, I think, is so effective, and that's what the MAPS research shows, is because the major effect of MDMA is threefold. One, it opens your heart, and you don't know how close your heart is until it opens more than it happens to be.
So
open.
What do you mean when you say opens your heart? Because you don't mean the physical heart.
No. It opens your heart. I think we use that phrase to be accepting, to be loving, to allow in the fullness of the other. Like if I open my heart to you, then I'm not defensive. So all defenses disappear. Because defenses are like remnants. It's like most people who are traumatized walk around in armor because the armor saved their lives when they were attacked.
Right.
But war is over, but they're still in their armor.
Right. So it opens you up. It allows that trust.
Yeah, MDMA allows you to be without armor.
Which is scary too, vulnerable.
It could be if you didn't trust the person you were with.
Right.
The second thing it does, it presents you. Like suddenly, you're in the moment.
Okay.
Whatever happened, you really feel it's done. The past is finished.
Right.
So it doesn't present itself anymore. The past doesn't present itself. It doesn't interfere with the present. So you're present, which most people don't know about because they either worry about the future, which is opaque and it's useless to worry about, and past is done. So why do we tear ourselves out of the present moment? Well, because you do it by the seat of your pants and it takes your breath away. That every moment is a critical moment. Like, who wants to know? So then we are able. But MDMA allows you to get there. And the third thing is suddenly you feel no shame. And again, you don't know. Ask a fish about water. The fish says, what water? If you swim in shame and you have swam in shame all your life, you don't even know that you're ashamed.
Right.
You're so used to it. But under MDMA, for the first time in your life, perhaps, no shame. Present, open heart. Wow. Then you look at your therapist. And if the therapist is truly a decent human being, then 10 years of trying to learn to trust that guy is condensed into that MDMA session. And by the end of the session, you trust that guy. And one of the things about MDMA is that when it's gone, you don't forget the experience.
Right.
So it's not state specific what you learn under MDMA. One of the difficulties with LSD, in my experience, is that LSD, beyond a certain dosage, high dosage, you forget what you learn. You come back to ordinary state of consciousness, very much like alcohol. Like when you're drunk, really drunk, you could do something. When you get sober, you don't remember it. You have to get drunk again, and then you'll remember it.
Right.
State-specific memory. And LSD is like that, but not MDMA. So whatever you learn in one session, you never forget. So it shortens therapy and deepens it. It also allows you, since there is no shame and you're open-hearted, with the therapist's help, to remember and grieve, because the trust is there. So you can suddenly go and touch on your trauma with one hand, and with the other hand, hold on to the therapist who is here and now and safe. And then you can go back and forth. And when you were hurt, an alarm was set off in your nervous system. An alarm has been ringing maybe for decades, and you can turn that alarm off. Because now you know that then is not now, which you didn't realize before. So you can you imagine the relief of such a maneuver? So that's how MDMA can help.
Right. So do you think, so you've worked with MDMA and LSD, and right now there's a lot of other things being thrown around in the
It's all the
psychedelic realm. What do you think about things like ayahuasca and
It's all the same. I'm all for it. I'm all for everybody figuring out what works for them.
right?
It's like it's very pragmatic. I've talked to people who try ayahuasca and never want to do it again. I know
Yeah.
people who ayahuasca fits them. But it all takes you to the same place. It all takes you to, whether it's synthetic or natural. There are people who feel that psilocybin, ayahuasca, ibogaine, mescaline, peyote are somehow superior
Right.
to LSD, MDMA, which are synthetic drugs.
Right.
But I think that's again a kind of one-upmanship,
Right.
and sectarianism.
Sort of ego of my stuff is the best stuff.
That's right. And there are Buddhists who say you shouldn't take psychedelics.
Right.
There are people who take psychedelics who say you shouldn't meditate.
Yeah.
And the people I really respect say do everything. Do what you
Try
want.
it out.
Yeah.
Yeah, I like that as well. There is a lot of that in this psychedelic stuff, especially when you get into the traditional shamanism approaches, where a lot of them, they have their specific practice, and what they sort of end up saying about is that this is how it has to be done, and everything else is hooey. And
that's power, you see.
Yeah.
That's where power enters into it. Like there is a religious experience, but once there is a religious experience, when religions start, somebody wants to make money on it.
Yeah.
Somebody wants to say, you can't have it. You can only have it through me.
Right.
I'm the expert. Like, bullshit. When people start pretending that they have religious experiences when they actually don't.
Right.
If the sacrament that Catholics, what is it called?
I don't know.
When you line up, go and you kneel down and you open your mouth and the priest puts in the body of Christ and you drink a little wine.
Yeah, the wine and the bread.
Yeah, the wine and the bread. So that ceremony, I mean, imagine when it would be real is if there was LSD in the sacrament, so that everybody could have an actual religious experience.
Right. I see what you mean. And
because the experience, and this is what's common in all these substances, natural or not, is that they take you to a point where it becomes absolutely apparent that you're a small part of something larger than yourself.
Right.
That you're not a skin encapsulated ego. So you suddenly, and that's the religious experience, is to realize that you're just a small part of something larger than yourself. That maybe there is only one intelligence, and each of us tune into it. And, Laing used to say, you're only as smart as the company you keep.
Right.
But even intelligence is a social phenomenon. So once you realize that, say, up here, we are separate, but down here, we are one.
Right.
And in ordinary consciousness, we can't go below here. So we really believe the illusion that we are separate. And under LSD or ayahuasca or whatever, you will slide down here. It's such a relief. It's such a relief that you're not just an isolated dingling, but that we are connected. You're never alone. Wow.
Right. And that experience is reported throughout all of these substances.
Of course.
That same type of thing. So if you believe that and believe that all of these, whether synthetic or from the earth, that they all provide the same experience, what do you think then that these things are? Do you have a belief? Because some people talk about it in a very spiritual way, where it takes you to a spiritual realm connected to the Great Spirit, or other people see it in more, analytical ways. Or
who cares? One of my first conversations when I went over to England to be with R.D. Laing was we told each other about some of our LSD experiences. And so then Laing kind of looked at me and said, okay, so for sure, for certain, you had those experiences, right? Right. And for sure, I had the experiences I talked about. So you believe me, I believe you, right? Right. Okay. The problem is this, and nobody very much asks, what does it mean? Okay, so we both had the experience of melting into one, that there is only one thing, the seventh chakra stuff. Here, the sixth is you're one with every living creature. Here, you are the universe.
Right.
Okay, everybody who gets to a certain point has that experience. Yes, for sure. But what does it mean? Nobody knows.
Right.
And I, for one, am not interested in explanations. That's why I'm a phenomenologist. I'm interested in the phenomenon, because explanations are dime a dozen, and they're all made up. They're all stories.
Right. So it doesn't matter to you at this
I don't
point.
care. I don't care whether it's a poisoned brain,
Right.
that the brain does these things and have nothing to do with reality. I don't care. Or whether it's really opening doors of perception and you see a truth that no one ever has seen, or only selected people have seen, or it's really the truth.
Right.
We'll never know. Like, there is no way of knowing.
Right.
There is just none. It's like, is there life after death? Well, who cares?
We can talk about it all day, but at the end of the day, and I like that too, and I have that perspective as well with these substances, is that they have the ability to help people. And right now, that's, I think, the most important thing.
Experience helps, regardless of is it a neurological
Right.
malaise, or whether it's true insight into the nature of the universe. Doesn't
Right.
matter. The experience is all engrossing. The experience is transformative.
So I think I'm going to backtrack for a second and talk about psychotherapy and what you said as things being at the root, and that trauma is at the root of these problems that people develop over their lives. I think some people, I can imagine some people listening to this and just having, you could almost say, a more analytical, even masculine mind approach, where they think about something and think about, why can't people just get over stuff? Why is it that you have a traumatic event when you're 3? Or, I mean, I think you've even written a book, correct me if I'm wrong, but about things that happen inside the womb to people. And that something that happens even before you're out of your mother's body can actually affect you for the rest of your life at times. And so why is it then that we hold on to these things so much? Do you have any explanation for why these are so hard to get over?
I told you. I am a social phenomenologist,
Right.
Meaning I have trouble enough to describe and depict what is.
Right.
Without going into the dubious question of why. It's the how and the what that is very interesting. And most people don't even bother accurately describing what is going on.
Right.
It's a description. That's how it is.
Right.
I don't know why. And anybody who says, why don't you just drop it? In a way, they're shaming.
Right.
Because they're ignorant assholes who think who don't give credence to the other, who don't respect the other, who don't believe the other, that I would like to, and you know what? I can't. The past presents itself.
Right.
I was a kid, 3.5 years old during the 4 years old during the Second World War in Budapest, in Hungary. And so I remember the sky being red because so many buildings were burning. I remember explosions, bombings, machine gun fire. It was mayhem. And then in 1956, I was there during the revolution where the Russians came in. Again, I heard a lot of explosions, gunfire. And once I was standing in line for bread, and a Russian tank went by and machine gunned the line. And every second person fell down dead, including my classmate who was beside me. Okay, there are these experiences. Even today, if a truck backfires, here now, more than 50 years later, okay, a truck backfires, I go like this.
Wow.
Now that's post-traumatic stress disorder, right? Like I don't want to do it, but it's in me. Like something in me, the past presents itself. There is no danger. Here is another example. I'm working with a kid, maybe 7 years old. We are sitting on the floor. I have longer hair. I take my hand and want to take the hair, just a gesture of taking the hair out of my forehead, out of my face. And the kid goes like this because I raised my arm. I immediately know that his father beats him. And he thought, post-traumatic stress disorder, his past presented itself. It would interfere with his relationship with me. He can't trust me because he thinks that behind my face there is his father.
Right.
Like if some asshole comes and says, why can't you get over it? Like, get lost, man. You're not helping.
Right. That's not helping. And I think some people, some people who are, I've met people who are very overly analytical, I would say. And then they almost want to pretend that we all live our lives without emotion, that emotion doesn't even come into play, that people just make decisions but the fact is that just for whatever reason, we live very emotional lives. And in one day you can go from sad to angry to depressed to inspired to whatever. And
well, look, Laing once said that he wondered what kind of people go into psychiatry. And he said people who suffer from psychophobia, which is the terror, the fear of their own psyches and other people's psyches. It's the fear of emotions. It's the fear of other people's and one's own souls. So if I am afraid that I will go crazy, then one way to reassure myself is to go into the business of those who control and predict madness. Psychiatry, the science of psychiatry, we control and predict. And I want to control. I want to control other people's psyches. I want to control my own. And I want to be very rational because I'm terrified of the irrational. I met a psychiatrist, Dr. Pierre Flore Henry, a Canadian psychiatrist, who said to me, and not joking, seriously, he said, what's this deal about ecstasy? Not the drug, but the experience of ecstasy. I don't want to be ecstatic, he said. Ecstasy is, he says to me, cerebral disorganization. Why would I'm happy to have my cerebrum organized. I don't want ecstasy. Well, I'm sorry for him. But so I think people who are what you call rational and controlled and know what's what and they can control it, like good luck to them. One of the beliefs of psychiatry is that there is us, we are the rational, we are the doctors, we are, and there is them, the madman. And there is a divide. And because they don't want to think about the fact that any moment each one of them could be mad or might already be madder than their patients.
Right. Even early on, you were kind of hinting at that it's modern psychiatry who are the madmen.
Well, I really think we are in the dark ages.
Yeah.
They still perform lobotomies. They do electric shock. Now you can have you can walk into a mental health center in Vancouver and get electric shock, ECT.
Really? I didn't know that.
Well, maybe next time you're in Vancouver, line up.
Check it out. So maybe to end, it's probably a good idea to also touch on, then we're talking about psychedelic drug use, maybe touch on dangers. And I'm sure, you've been using some of the stuff in controlled settings and everything, but what are some of the challenges that you've faced as a therapist, but also in other situations with these? What do you think the risks are for people?
Well, the best selection of, in the medical model, one question always comes up: selection. Who we can do this with, and who we should never do that with.
Right, I see. People prone to schizophrenia or something comes up a
That's right.
lot.
That's right. If you're schizophrenic, if you are manic depressive, if you're bipolar, no, you can't have this treatment.
Right, right.
I would say that the best selection is self-selection. I would say almost deeply instinctively, some people just want to stay away from it. And I support them 100%. I would never want to talk anybody into it. I would never promote it. I would never say it's a panacea. But equally strangely, some people really seek it. Some people want the experience without knowing anything about it.
Right.
Like the very first time I took LSD, I didn't know what I was getting into. Like, no matter how much you read about it, no matter what people tell you about it, the experience is a total surprise.
Yeah, that's true.
So in a way, one has to be an adventurer.
Yeah, you have to want it in order to pull through some of these maybe more challenging experiences.
There is one other criterion that I sometimes watch out for. Because, say, taking LSD or MDMA is a kind of event. It's a big deal.
Right.
If you come to me and you say you want this kind of treatment, and we talk, and I realize that you're overloaded with responsibility. Like you carry the weight of your family, you have lots of responsibilities at work, financially you carry a big burden. You're really kind of the strong man in your family and among people that you work with. And I'm beginning to sense that you're actually a bit suicidal. That is, you think you could lighten your load if you could only die. Like, this is the only way out for you. You don't have the wherewithal to say, no, I don't want to do this anymore. You might want to exit by killing yourself. Then it may not be a good idea for you to take LSD, because there is a moment when you're gone, really gone into an altered state of consciousness, where there is a kind of choice that, do I want to come back? And then it could occur to you, hey, this is an opportunity. I could just go crazy here. I could be one of those people who go psychotic because of LSD, never come back, and then my family will have to take care of me, and doctors will take care of me, and I will have no responsibility. So if I have a sense, then either I would say, don't do it. I don't want to give anybody this option of exiting from their responsibilities by going crazy because they took ayahuasca or LSD or psilocybin. Or I would say, well, first you would have to be in therapy until you find your way out of being overburdened.
Right,
so
I see.
You're not even tempted to use drugs to go AWOL.
That reminds me of something someone said to me. They are afraid of heights, not in like a hugely phobic way, but they just don't like heights. And I asked them why what did they feel? Why didn't they like heights? And they said, it's not that I think I'm going to fall. It's that I think I might jump. I thought that was really interesting.
Yeah.
That same, just by providing the option, that's if they're in that state, if they're in any kind of suicidal thought pattern.
Yeah. So but look, aspirin is dangerous. All this thing about dangerous. Like bicycling is dangerous. Like, hello.
Yeah, there's a lot of things that are dangerous that are completely legal and acceptable to
Yeah,
do
yeah.
all the time. Yeah,
So
I absolutely feel the same. It's
yeah,
ridiculous.
yeah. Of course, look, anything exciting is dangerous. Uh, uh, Maximum security is a prison,
Right. Yeah.
and death is perfectly safe. Life is extremely dangerous. So
Yeah, this idea that we have to numb everything or nerf the
yeah,
world, turn it into some safe playground or something.
yeah, yeah, boring.
Yeah. So how do you think that, how do you, like, you've been working with MAPS, who is really on the front lines with trying to push legalization for some of this stuff. You know, do you have any inkling of a timeline or
5 years.
how you think?
5 years.
5 years?
I would say if they keep going like this, and
Yeah.
they're doing a very good job, I would say 5 years for MDMA, 7 to 10 years for LSD.
And do you think it will be legalized in some way that is like a doctor prescription only sort of deal?
Well, a prescription to a practitioner who was certified by MAPS,
Right. Yeah. They're going to be
or
the
these
power.
organizations will proliferate. There will be uh, some bodies, respectable bodies, who will train these people. And once you have your certificate, then you can requisition these drugs and dispense to people who you think can handle it.
Right. That seems to be the way it's going now. I am in the similar boat as you, where I just I hope that it can be available for people to use in other ways as well, not just in the very strict type of setting.
Well, but it's a good first step.
Yeah, exactly. And
At
that's why I do
least,
support MAPS as well, because it's they have to do it this way. We have to
yeah,
push it out. Yeah.
yeah. At least the substances will be pure
Yeah, that's
once they're
true.
legal.
Yeah, and that's one of the other huge risks right now with these substances is that if you get something
Yeah,
like ecstasy that says it's MDMA, it might have a ton of other stuff, might be speed and other things that
absolutely,
are, yeah.
absolutely. Yeah.
So, now that you're done with MAPS, what are you out working on now? Do you have any future plans for any more?
No, no, I have no future. Uh,
You live in the present, I suppose.
Look, I'm 75. Don't talk to me about my future. Uh, I have a past.
Right. So
No,
no,
no. I do it day by day. I'm very excited that I was working at Hollywood Hospital here in Vancouver. That was Ross McLean's hospital, where they did very serious LSD work and research with alcoholics and creativity in New Westminster.
right.
Now it's a parking lot. That was in 1969 when I first came to Vancouver. I did volunteer work in that hospital. So, I've been interested in these mind-altering drugs from about 1967. So
Wow, yeah.
I'm just very happy that after over 40 years of nobody even doing research with it, now at least it's a topic that
Yeah,
people can talk about.
absolutely, yeah.
So no, I have no plans, but I'm open to things. And
Okay.
right now, my major effort is to remind people not to underestimate the therapeutic relationship, even when these potent substances are used. Like in LSD therapy, yes, LSD is marvelous and magical, but it has to be in the context of therapy. If the therapy is wrong or mistaken, then the LSD can do enormous harm. So I think in all these psychedelic or entheogenic assisted therapies, I want to, before I die, I want to alert people in this technological zeal of underestimating the human connection and go with the technically miraculous substance. Don't forget the relationship.
Right. Yeah. I like that. That's something I did have that thought when you were describing how MDMA works, and that it can put you into this very vulnerable state. And then if you were with the wrong crowd or you're with someone who didn't have your best interest in mind, that could be a very traumatic experience in itself.
Absolutely. If the therapist is not on the level, if the therapist hasn't, that's another thing. For example, MAPS up till recently wouldn't have the therapists take MDMA,
Oh yeah,
MDMA.
right.
And there was back in the 60s a hospital, a mental hospital in California. Julian Silverman was the head of that ward. He wouldn't allow any psychiatrist, any nurse, anybody work on that on his division who hasn't had an LSD session with him. Only people who have experienced LSD could work with so-called schizophrenics in that ward.
Right.
Well, I think that's commendable.
Right, that makes sense, to at least have had the experience. But what
That's right.
about taking it with the patient? Do you?
Well, that's a whole other thing. Stanislav Grof, whose personality is such that he would rather not get involved. He just kind of hangs around the person who is doing it. He in all his research, because also he's a doctor and he conducted research, he never took LSD with his patient.
Right.
On the other hand, Laing always did.
Right. I think I've heard you speak about that before. That idea, you spoke about it in that terms of that relationship structure, where if you are not taking it, you're not on equal ground.
Absolutely. It makes an enormous difference. That we are in it together, or whether it could freak someone out. That, let's say, you take a large dose, and I'm just kind of kibitzing here on the outside.
Right.
You might think that I have an objective gaze, that I'm kind of looking at you as if you were some specimen sprawling on a pin. Like, that could cause so-called paranoid thoughts, which wouldn't be so paranoid. It would just, there would be a chasm between us.
Right. Or this idea that something could happen and you have to be sober because I might freak out and I'm going to need a sober person. Or,
one way to do it, as Laing did it, is you take half the amount as your patient.
Right.
And because you are at home in it and very practiced, you can deal with emergencies. You can come out of what you take, or you can take as much as your patient and be there and have a third person who is just taking care of the perimeter.
Emergencies.
Yeah.
Right. Well, I like your perspective a lot when it comes to this stuff. Is there anything that you want to mention before we sort of wrap it up here?
No, I said everything. I said more than I want.
I appreciate that.
Okay.
Is there any way, what's the best way if anyone wanted to reach out to you for whatever reason? Do you have any kind of social media, Facebook stuff, or people?
Sure. Yeah. I have a Facebook page under my name. Nothing's hidden. Okay. And I have a web page of my own, andrewfeldmar.com.
Okay.
All one word. I'm easy to find. I have all sorts of stuff on Google. No, on what's all the videos?
YouTube.
On YouTube.
Right.
Just put my name in, you get lots.
Okay, perfect. Well, I'll link to those as well in the description to this. And just thanks so much for talking to me, for rescheduling, and I really enjoyed it.